all can't believe when this first happens to us that our child has this disease. Like most people who have this disease, the progression starts with prescription medication. And so for her, it was like she started using pills and then boom, she was using heroin, and it was an entirely different world. And she said, you know, this wasn't my life plan. I have this picture of Rebecca as Tinkerbell as a little kid. So I'm, you know, looking at Becca in the hospital, but her face has changed and she is angry and manipulative and doing anything she can to feed the disease. And so when I would talk to her, I would think she was Tinkerbell. It wasn't Tinkerbell anymore. And that's a really hard thing for parents to realize, is that your child is different than how you thought. I had to love her enough to get her into treatment too. And that's a really hard place for a parent to be. And you think you're alone. You think that there's nobody who can be going through this but me. You know, I'm thinking about, what didn't I do? I should have done more. So as you're in the crisis and she's trying to get medical help, you are struggling with just the whole sense that you let her down. I think the health professional can play a huge role in somebody's treatment. When the patient comes in, one of the things that you notice when you go into an ER with your child, and the child has substance use disorder, the conversation between staff with other patients is warm and inviting. You're in an ER with a child who's overdosed. It is a different conversation. There is barely any. So if you think about it, they're disconnected from their own life, and then they go to a hospital when they're suffering. And if you're not treating them as a person, how do they feel? Well, they feel shame, right? And the shame overwhelms them. And how do they get rid of the shame? They use drugs. But if they're connected and somebody cares about them, then they've got a fighting chance to get into recovery. When you go in to an ER, or you are suffering from this disease, to have somebody validate that you're a human being and that you are worthy of medical treatment, if you can hang in there with them, you can see their recovery. It is remarkable what these kids do. If you're a doctor or you're a nurse and you call that person by their first name and you look them in the eye and you treat them as a human being, that's how stigma gets replaced with caring. The journey is so hard for a parent. And so you get these moments, these glimpses, right, of what might be. Or somebody gives her a kindness in an ER or helps her, right? You know, there was a woman at the detox who worked the weekend to get her a bed. Sorry. And, you know, she gave her time to get Becca a bed. And that may have saved her life. That's pretty remarkable how much impact a caring medical professional can have for somebody. Caring about her as an individual. Listening to the family and the story and trying to understand it so that she's treated as a valued patient. Wow, that's profound.